Okay, now we are currently in the middle of this huge surge of COVID-19 cases, especially here in California. Tragically, last week, a GOP congressman elect, Luke Letlow from Louisiana, died from the virus. He was only 41 years old. What do you think it will take for this country to understand that this pandemic is serious and we need to get it under control?
I mean, we have just been drinking from this fire hose, first for the last 4 years, and then to be in the midst of this global pandemic for almost a year, and the economic hardship that this has wrought, and then all of that happening against the backdrop of a national reckoning on racial injustice. Um, People have been experiencing really unprecedented hurt, you know, bearing the gravity of these three conflated crises: the pandemic, again, the economic inequality and hardship, and this national reckoning on racial injustice, and just a colossal, tragic loss of life. What I really think is going on is that they've become numb. I think we
Mm,
have normalized, we have been drinking from this fire hose of trauma for so long that perhaps people are
that's right.
normalizing this. When you see these sobering statistics, and bear in mind that these are not numbers, every number represents a life, someone who
Yes.
loved and was loved. And so it is. Everyone, please do continue to do your part. Be responsible. Slow the spread of this
Yeah.
virus. I know that y'all are tired of the pandemic. You're tired of masking up. You miss your loved ones. You're tired of the social isolation. You want your kids to go back to school. The sooner you
Yes.
are consistently practicing and taking all of those, honoring those protocols and those precautions, the sooner that you can be reunited with loved ones, your children can return to school. But again, the greatest wealth of our nation is the health of our people, and it is currently in peril. And so everyone
Yeah.
needs to continue to mask up, to wash your hands, to socially distance, to get tested as frequently and as oftenly as you can so you have a baseline. And then again, we need to elect John Ossoff and Raphael Warnock so we can regain control of the Senate and have a Senate that is led by people who believe in things like contact tracing and will
Right.
vote to make the massive federal investments that are necessary to support our essential workers, to support our community health centers, to make the investments in our schools so that they can safely reopen, to make the investments in robust contact tracing.
Yeah.
Um, you know, so all of it matters, all of it's on the line, but right now everyone must exercise personal responsibility and do your part to slow the spread of this disease. Yes, the vaccine is it is very encouraging that we are rolling that out, but it is going to be quite some time before we hit the density that we need to in order for us to really see the impact of that. And
Yeah.
even after you've taken a vaccine, you still need to continue to practice those COVID protocols and to honor every safety measure to slow the spread of this disease.
Yep.
Yes. And
Well
that people
said.
are so sadly mistaken that we're in the clear because the vaccine has been announced. Because as of yesterday, only 4.2 million doses of the vaccine has been administered, which is a way lower number than that was expected. So you yourself got vaccinated on December 19th. How are you feeling? And tell us if you
Wow.
experienced any side effects. We're hearing firsthand here.
I feel fine. And I want to say that, look, I have been fighting for the very beginning and will continue to for the most vulnerable, from our nursing homes to incarcerated men and women, where we continue to see huge surges amongst incarcerated men and women, but also correction officers throughout this country. For our essential workers, for our frontline healthcare workers, I'm going to continue to fight for our most vulnerable and those hardest hit communities. Um, I took the vaccine. One, because I cannot continue to do my job and to fight for the most vulnerable and to center those hardest hit if government is not functioning. And we are some 436 members of Congress. We are flying often. And then we are, coming here to to do the people's business. And we run the risk of creating our own surge, given the number of members, how often we are traveling. And so for the purposes of continuity of government, but also because I know that the medical community, by practicing medical apartheid, has violated the trust of African Americans, of indigenous people, of Guatemalans. So there's great fear and skepticism about the vaccine. And in that, the coronavirus is now the third leading cause of death for Black Americans. We are three times more likely to contract it because of the comorbidities of structural racism, unequal access to health care, higher representation of health disparities and pre-existing conditions. Yeah. I have 2 pre-existing conditions. So I'm like many Americans, like many Black Americans, and in an effort to foster some confidence and trust, that is why I took the vaccine. Because our communities, communities of color, marginalized communities have been hardest hit and have the highest fear and skepticism about the vaccine. So I want them to know that a young Black woman developed this vaccine. So in Dr. Fauci, I trust. In Dr. Kizzy, I trust. And I took the vaccine, one, to ensure continuity of government, but most importantly, hopefully to engender and foster a confidence in people, particularly Black Americans, in taking the vaccine.
And that is the Moderna vaccine that Dr. Kizzy.
Yeah, exactly.
We just want to, make sure we say that.
Yeah.
Congresswoman Pressley, thank you so much for motivating us, inspiring us, and taking the time to speak with us today. Thank you. And please do keep up the good work. Keep inspiring us.